Now, the Union Health Secretary had a video conference with states to review this and strategize on the response to tackling COVID in the light of the new variant and also focusing on vaccinations. The centre said prepare medical infrastructure and ventilators lying unused, promptly dispatch samples for genomic sequencing, ready hospital infrastructure for a surge in cases, and ventilators given by centre are lying unused at some field hospitals. Also, to maintain adequate buffer stocks of 8 critical drugs. Well, to talk more about the preparations, we're now joined by Dr. Suranjit Chatterjee, Senior Consultant, Internal Medicine, Indraprastha Apollo Hospital, and Dr. Hemant Deshmukh, Dean, KEM Hospital in Mumbai. Thank you so much, doctors, for joining us this morning. Dr. Hemant Deshmukh, first to you, what is your view now of, this Omicron variant? So far, we've seen it spreading to over 57 countries, is what the WHO said. But even after all these days, it seems that the evidence points towards a milder disease.
Good morning, Gargi. As we have spoken earlier, that any kind of virus does not respect borders of any countries or does not respect borders of any city or a state. So my simple answer to everything would be that we need to mount a lot of surveillance at the borders. What I mean is that all the airports should have strict surveillance on travelers who are coming from high-risk countries or any other country where the predominance of Delta variant or Omicron is very high. Now, once said this, what we need to check is the reinfection cases in India. Now, most of the cities that are seeing a spike in the number of cases, especially the Delta and the Delta derivatives, we need to mount surveillance on the amount of reinfection cases which emerge, which I simply mean that two diseases which were forgotten in the last 6 months, that is the influenza-like illness and the severe acute respiratory illness. These are the two diseases where we can mount surveillance to see to it that the Omicron virus does not spread. ILI or SARI are the hotspots or the clusters where if you find them, you need to mount surveillance, do a lot of testing, you do a lot of surveillance and see to it that patients who have even mild disease are being tested. Now, once you test them, you need to isolate them. Now, there are two peculiar conditions which will happen once you isolate or in fact, you separate them from other COVID-19 patients. So any kind of Omicron virus suspect has to be isolated separate from the COVID-19 Delta or Delta variant. So this will ensure that there is no cross-infection amongst the people who already have COVID-19 in the isolation wards. Now, one thing which is very important is you have to just see to it that all the hospital infrastructure, which we were always telling that the ventilators should be functional, the HFNO should always be ready at hand. The PSA plant which we have installed in the last few months should be functional. A dry run is mandatory to see to it that any kind of glitches at the last moment should not happen. And O2 concentrators obviously are ready with everybody in all hospital settings.
All right, so just prepare and perhaps this is a wake-up call with the emergence of this variant. Dr. Suranjit Chatterjee, the other point the centre has made is to send the samples for genomic sequencing so we can identify whether it is the variant. But it just seems to take so long in the country. We've identified some over 20 cases of Omicron so far, and one imagines that there are probably a lot more, in fact, waiting on the results of several tests.
That's true. It takes a long time, but fortunately, in the last couple of weeks, the duration to identify a genome sequencing has reduced. And now it is 3 to 5 days that you can get the genome sequencing done. But it's obviously very important for the hospitals and for the government to coordinate so that the genome sequencing is done fast so that they can be identified early. And as Dr. Deshmukh said, because they have to be isolated from the other patients so that there is no cross-infection from one person to the other. So it is absolutely mandatory that we work on this early so that we can do the genome sequencing faster.
No, absolutely. And Dr. Deshmukh, again, coming back to the reinfection bit, that just seems to be the biggest worry. And this has also led to, a lot of people demanding the booster doses. And that's one debate that has been ongoing. We're still waiting for, the government bodies are also holding more meetings to, decide on this and debate whether it is needed at a time when we still need to vaccinate a majority of our adult population.
Gargi, fortunately, we have a bumper stock of vaccinations lying with us in India. And what we need to do is see to it that we get vaccinated as fast as possible and get boosted simultaneously, because it's almost 12 months that the entire country started getting vaccinated. The another point which you rightly pointed out, that the infrastructure along with vaccination needs to be boosted much more higher, and anybody who is in the higher risk group, that is the healthcare workers, anybody with comorbidities like diabetes, hypertension, or any other medical condition should be boosted all the time, because it's almost 12 months that the antibodies get depleted.
Especially you healthcare workers, you all got it at the beginning of the year. And Dr. Chatterjee, the other issue everyone's waiting on is on vaccines for children, because that would also help cover, a large part of our population.
Absolutely mandatory. It has to be done early, because what we are seeing in South Africa and all that quite a few young children are getting infected with the new strain. So it is absolutely important that we go ahead with it in a faster way, approve and vaccinate as many people as possible. That is what I find very important, that the first 2 doses of vaccine have to at least go in for everybody, so that at least there is some sort of immunity which has built up in most of us, so that there is a sort of a herd immunity. Although there is obviously a doubt that Omicron might have an immune escape phenomena, but at least the first step is to immunize as many people as possible, and obviously then the booster doses would come in.
Right, and include children in the vaccination drive. Thank you so much, doctors, for joining us on the program this morning.